going to start the recording. Want to warmly welcome you to this first global event of the Impact Accelerator. This is the 25th of February. My name's Rida Sadki, and I am speaking to you from Geneva, Switzerland. For those of you who are watching on Facebook, if our room is over capacity, you are welcome as well. We'll be keeping an eye on the Q&A. We may not be able to answer all of your questions, but we'll definitely be answering the questions of those of you who are in the room. Obviously, many of you have been introducing yourselves already in the chat, but please do so if you have not already. Find the chat window. Some of you may be joining a Zoom session for the first time, so you're especially welcome. And just relax. You'll figure out how this works, whether you're connecting from your phone or tablet or computer. You will be able to not only ask questions using the Q&A tool, but also vote for the questions you want answered. And that's actually the important part, is to figure out which questions you want us to address, and only if you don't see your questions should you submit it. So let's get started. This is an event organized and presented by the Geneva Learning Foundation under the umbrella of the Teach to Reach Accelerator program. So you can see the names of the International Advisory Board for the Teach to Reach Accelerator, mix of distinguished learning scientists and immunization leaders. You can see many of them have joined many of the International Advisory Board members have joined the panel today to listen to the presentations and to learn more about the history before Teach to Reach of how the Impact Accelerator got started, which is what we're going to be covering today. Indeed, we are not starting from scratch. We're starting from a network that is already 15,000 strong and growing fast. Today, you're going to be hearing just a few of the stories of individuals who've led perhaps modest, but nevertheless remarkable change from some of the 90 countries where people are working through this program and through the accelerator to make change. The story we're going to be sharing with you today is underpinned by at least, two pillars, two foundations. One is evidence, and you can see here three of the researchers who've contributed in various ways to getting a better feel for what difference this program was making in its first 2 years. And this informed what we're going to present to you today. Second, we worked with hundreds of scholars from many of the countries that then became involved in the accelerator to co-design the accelerator. And really, what we're going to be sharing, what we've done so far is an experiment, but it's an experiment grounded in evidence and experience and the needs of practitioners. The takeaway from the first 2 years of the program was that these are more than just courses. And I hope you'll not only see that and see some of the data points that we have to share with you around that, but also feel it through the narratives that you're going to be hearing today. So a few takeaways that led us to design this Impact Accelerator is, first of all, we saw extraordinary high levels of use of what people gained from the program. Second, scholars who came to us and said, I have achieved impact. We try to understand what that meant, and we found that in some cases they're able to connect the dots between the intervention, what they did with it, and a change in coverage or contribution to that change. Third, we saw really interesting effects of how peer support in the course actually had an effect beyond the course to make a difference in terms of the ability to take what you gain from a course and put it to use. So we found basically that without any support, scholars had already been able to achieve, in some cases, significant impact or contribute to it. So we asked the question, what might we be able to do by working together with the right support from partners? So after several weeks of working with scholars, we came up with this statement. We said it's not about the platform or the network. It's about you. It's about you, the practitioner, your leadership, your capabilities, your potential, your commitment. And furthermore, this is evidenced by your effort and persistence in the program, by that willingness to help others, by the allegiance that we have to each other. and it's driven by commitment. So we then began with Ian Steed, with Alain Blaise-Tatsinku, with many other members of the Scholar team and scholars. We began to sort of sketch out. I think this is one of Ian's early sketches. This is another one. We already had all kinds of frameworks and ideas. We mapped out what the overall flow looked like. We tried to figure out the nooks and crannies of really what the mechanisms would be to actually go from courses all the way to impact. And really what it boiled down to was really a statement and a question. The statement was, you have developed an action plan. That's a key part of the learning journey with others. And then the question is, are you ready to take action? That simple binary, of course, was underpinned by a theory of change that we then set about trying to figure out how together we could turn it into practice. So in July 2019, what did we do? We invited scholars, and 640 from 55 countries signed the pledge to achieve impact. What was in that pledge? It was the first of 4 pillars, and it was actually a moral commitment, a moral dimension to adding to the professional and the technical commitment that scholars already had. And really the core of that moral commitment is to supporting each other. So it is a moral commitment not only to the organization or the country, but also to other individuals working towards to achieve the same objective. Quickly through the measurement, we saw in July, in just 4 weeks, we basically had 42% more people who said they had started their project implementation. Second, we also saw that participants were quite willing to contribute a lot of data, give us a lot of detail about what they were doing, and that there's a benefit for us, but there's also a benefit for them. And we started to see things like this. For example, countries that reported they had, or country groups of scholars who reported that they had been in touch with their EPI authorities. In some cases, the national EPI manager, so the expanded program on immunization, national manager in the Ministry of Health, became and led the scholar group for the country. We saw in some cases impressive numbers of participants in some countries meeting on a regular basis and sustaining that commitment to meet, to define around purposes that, in adherence with the pledge, they had defined together within their specific and respective country context. And then we started to receive things like this. And this raised a lot of questions, obviously, but you'll be hearing about it later on in the presentation. And we said, okay, there is something going on there far quicker than we anticipated. We had told people, we do not expect you in 4 weeks to implement. We expect you to think about it and start collaborating in order to progress, and you'll tell us if that's actually a meaningful activity. But over the next few months, we then began to document a little bit more rigorously what had been happening. What were the changes that were being led by scholars in different countries? And this led us to realize that actually what we had was a system to support, for mutual support, for peer support, and that the insights we're gaining could benefit both the scholars and the system if the system was in fact listening. And you'll get to hear how, at least in some countries, that system listening and the double loop feedback has already happened. Next is a share. So the collaboration with country colleagues really emerged as the most valuable aspect. And you'll be hearing a lot about that. In fact, most people ended up working in country groups on a country project, which we had not anticipated. We saw that there was this continuous flow, not just from countries, but also between countries. These are some of the slides you can see from the different presentations that took place during the 4 weeks. And remember, the whole point was not only to measure and to share, but it was also to mobilize. And so these dynamics of momentum, of healthy competition, of networking, overcoming difficulties, and leveraging resources really became key to very quickly in the first 4 weeks of the program. Once the 4 weeks in July were finished, we didn't say goodbye, but we said see you later from the global coordination team, because we wanted to see whether country groups would be able to find and map out their own journey. We knew that digital learning had turned into this. These are some of the meetings that took place during July in various countries. You can see people talking, discussing intensely, mapping out what they're planning to do, expressing that commitment and that pledge that they had made to each other. We are together became a kind of rallying cry, so that in expression, some of which work better in French about, pressing on the accelerator. But overall, all across all these meetings, there's a few characteristics that I'll come back to that really distinguish this type of activity. So these are some of the numbers of what came out of the first 4 weeks. And I want to acknowledge and recognize the team leaders for the 11 Anglophone countries, as well as the 14 Francophone countries team leaders. In some cases, team leaders have already passed on to someone else, so I want to acknowledge their successors as well. But these were the first team leaders for these country teams, created by alumni of the program. So some of the insights that came up in a chat window very briefly, we try to capture to give a sense and retain something about what people were expressing about their experience of this new way of collaborating across distance to work for change together. The level of satisfaction, it was tremendous, as you can see. And why? What was so powerful about doing this, about being connected to each other, about so making that pledge, about basically filling out long surveys each week? A fantastic platform for information exchange. And I think for me, the key is here, it keeps the momentum. That, and more feedback. There are a lot of skills I gained from this course that many of my colleagues lack. If all of us would be on the same page, immunization coverage will be turned around the positive direction. So as Karen Watkins had described this in her study of the first 2 years of the program, she described the program as a human knowledge network. And that's what we try to bring structure to. And with the Impact Accelerator, going from that moment of learning from the best available global knowledge and turning that into an agenda of change, and betting that the solidarity expressed in a course could lead to new forms of solidarity in action beyond the course. So that was just 6 months ago. So in January, we did the second round of individual acceleration reports, and we went back to the scholars who had participated, as well as to those who had not participated in the Launchpad, and we asked them again, how were they doing? What progress had they made? And this, of course, was based on, and is based on, self-reporting. And one of the questions raised that we asked ourselves was, can we trust self-reporting? And then we had a kind of reality check. We're talking about a group, many of whom are in the room, who respond in very high numbers. We see increasing attendance in the online events. We see a vast amount of time spent each week dedicated to the activities related to the Launchpad. And this all happens with, let's be blunt, with no per diem being paid, no perk, no hotel, no travel, and no funding. We emphasized that this was about securing in-country funding. This was not about winning the global prize. So that's how we thought about self-reporting and the reliability of these figures. These are presented with a lot of modesty. It's only been 6 months. We're only getting started. It is an experiment. It is very imperfect. There's all kinds of imperfections we can see, but what we believe in is that commitment, being able to allow and empower people to express the commitments that brought them to immunization in the first place. We feel that's a really important dimension, and we should all be striving to be doing that. So scholars working together, yes, and most of them are choosing to work on a country team project or on a joint project. A third are people who, for example, in their district, developed a project in the course, and talked to their boss, talked to their colleagues, found the funding, and just went ahead and did it. And you'll be hearing about some of those stories today from the presenters. Second question we asked is, how are people doing? So basically, overwhelmingly, people consider that they have made significant progress. That at least tells us something about their satisfaction and their willingness to continue. The third question we asked was, is achieving this goal part of your job? In fact, during the Launchpad, we actually said, if you're doing the accelerator correctly, it is not something you do on the side and you have to stop work in order to do it. Is you bring in the project and then you leverage the power of the network in order to do it. That's what it should be about, and overwhelmingly, that's what people are telling us is happening. The fourth question is about the integration into the national immunization program, so the expanded program for immunization. And again, overwhelmingly, scholars who are working through the accelerator are developing, working on implementing ideas, some of whom that may be innovative and not quite fit into the country multi-year plan at this stage, but it is still part of the overall effort and drive aligned with the national strategy and the goals of the country. So these are not projects on the side that sort of in the shadows, but these are built on the best available global guidelines, and these are taken forward with, in most cases, full support of the national team. So next, we wanted to see what changed in 6 months. And so here we looked at the people who had been there in the launchpad, and then we went back to them and asked them. And you can see at the bottom is where people were at when they started the launchpad. So it'd been a couple of months before some of the courses, so many people had already started doing something, and we had prompted them in various ways to do so. 6 months later, you can see here that we've got around 14% who say that they have implemented their project. And of course, that begs the question, what does that actually mean and what difference it makes? But it's still a very interesting progression that that prompts us to go further. And then this one, we also wanted to compare. Some people chose not to participate in the launchpad. And so on the right-hand side, you can see that of the people who did not participate in the July 2019 exercise, 44% of them are just not doing anything with their projects. Now that raises a lot of questions. There might be some confounding variables in there as to explain how this large proportion, but nevertheless, that gap between, and the difference that you can see here indicates that there's probably something during the launchpad that happened that prompted people to do country projects and to work on their individual projects. So that's a little bit of the framing and the story so far. It's an incomplete, imperfect, a very modest story so far, but we feel it contains the kernel of something profoundly interesting that has the potential, we hope, to contribute to meaningful systemic change. To tell you more about that and really to hand it over to Charlotte. You'll be hearing from Charlotte Mbou, who was a scholar at the time of the accelerator and who participated in the launchpad, from Alain Blaise Tatsinku, who's one of our most experienced scholars, who will be telling you how he accompanied people in countries. And then you'll see definitely during the presentations that one country that's kind of stands out amongst those that have begun to harness the potential of the accelerator. So Charlotte.
Yes, Reda.
Yes, we would love to know more about how you experienced that moment in July 2019, and what are your thoughts following?
Okay, thank you very much, Reda. Good afternoon, everyone. It's an honor for me to be here. As Reda said, I'm Charlotte Mbou, formerly EPI data manager in the South region of Cameroon, and a scholar alumni. I have already done 4 scholar courses, and while I was doing my 4th scholar course on reducing inequities and improving coverage, I ran into an update on the scholar community inviting interested scholars to prepare an implementation strategy if they wanted to take part in the very first Impact Accelerator launchpad. So to me, it was an exciting prospect, as I have always wanted to translate the knowledge I acquired during the courses and through familiarizing myself with the WHO guidelines into actions on the field for better immunization performance in my region. I didn't hesitate to join the Impact Accelerator, and when the time came, I signed the Scholar Pledge for Impact. I joined the Impact Accelerator because I wanted to implement my project, and I needed the help and support of my peers and the scholar team to do so. I needed my implementation strategy to be reviewed so that I could improve upon it. Secondly, I also wanted to set up, with other scholars, a country group made up of Cameroonian scholars from different regions. It was a platform where we could learn together and encourage other colleagues to take part in subsequent scholar courses. I was pleasantly surprised by the enthusiasm which Cameroonian scholars, with which Cameroonian scholars embraced the Impact Accelerator and began to put themselves together to implement joint projects, either as groups or regional groups, or even as individuals. And we also got recognition from the EPI authorities. The permanent secretary for EPI in Cameroon officially handed over scholar certificates to scholars who had successfully completed their courses. Cameroon being a bilingual country, as you know, we have a French and English cohort, we're able to set up a national coordination team as well as regional scholar groups in all the regions of the country. Concerning my project, which was on reducing missed opportunities for vaccination at the level in a pilot district in my region, I was able to prepare a joint implementation strategy with another scholar from my country, and this project was peer reviewed. We improved upon it, and this year the project will be integrated into the annual work plan for my region and shall be financed by the partner UNICEF. As a scholar, to me, the Impact Accelerator platform enabled me to use WHO guidelines to come up with tailored interventions that could be implemented in my context to improve upon our immunization services and to ensure that more and more children get vaccinated. As a team leader in Cameroon, in the Cameroon Scholar Group, working on promoting our country group helped me to enhance my leadership capacities and skills. Through the Impact Accelerator, I came to understand the importance of teamwork and that there is potential that exists when we are people-centered, because everything about the Impact Accelerator, it was not about the platform, it was not about the project, it was about people, and it was about better immunization outcomes. So I would like to really thank the Scholar team for the support that we received while trying to set this up. And that said, I just want to thank you for your kind attention. Over to you, Reda.
Thank you very much indeed, Charlotte. Over to Alain Blaise Tatsinku about the experience of accompanying scholars working for change in their context, in their countries.
Yes, thank you, Reda. Once again, good afternoon, everyone. Good morning, depending where you are connecting from. So as Reda said, I'm Dr. Alain Blaise Tatsinku. I've been working for immunization and vaccine preventive disease surveillance for more than 13 years and in early recovery, emergency, and development setting. So let us focus on what happened in the scholar community. So let's talk about the Impact Accelerator. So we created a concept that we call accompanying. In that course, what is accompaniment? As you know, we are doing a digital course, and accompanies are immunization professional who succeed a course and get their certificate, but they didn't move up with that. They stay in the community because they found a place where a lot of things can be done, where you have that human connection we are talking among immunization professionals, although we are working remotely. So our companies, after giving the support during the courses, when we launched the accelerator, the Impact Accelerator process, we were using a different tool, a digital tool we call that P-Grade, which is basically an application to give and receive feedback when you submit your project. Then our companies were really active during that 4 weeks, intense 4 weeks, helping scholars to get along with the P-Grade application, where they can post their project and then receive constructive feedback from their peers. And that is what is one of the particularity of the scholar community. We always receive and give feedback each other in our project. Then from that, we move at the field level. And that is the most important part, because spontaneously, scholars were able to gather themselves as a group in certain country, or individually wanting to move forward with their project that they were having with the implementation plan. Then I came into action at that time, because what we were having the scholar community, as I said, was the human connection. So when they were asking questions using the digital platforms that we are using, such as WhatsApp or Skype or even Zoom, we were able to provide them the support that they need at any time. And there were a very good dynamic coming in some countries where scholars, like Charlotte was saying in her story, they understood that they were having a very, 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 very accurate situation analysis, and that they can put their project and action plan together with this innovative strategy to really impact the immunization program where they were working. And that was wonderful. And I feel spontaneously the need to fulfill my passion, my personal passion of contributing to doing something immunization. So the scholar community was a huge and a very broad platform where I can work with different countries, French, Francophone and English, Anglophone countries, and I met fantastic people. We have some human connection, wonderful with people calling themselves team leader or country group with their, it was easy for me to help them implement some plan, some strategy, how to come themselves together, how to make a link with the national API team, how to really remain aligned with the country priorities in immunization. And it was wonderful, because that's why I really want to share my joy with you, because we saw a tremendous movement, dynamic of school. I'm really happy to tackle actual needs of the immunization program. And soon we will hear a lot of this story. So that's what I want to, the outcome of what we've done is despite the technology, despite the digital skills, despite the technical in API, one thing happens that made really a huge difference. That was the human connectivity. That was people putting themselves together without any barriers from countries or region, just thinking of one thing, just thinking of their passion of immunization, just wanted to go and meet that last child who is not vaccinated, or that last pregnant woman. And that was fantastic, and that was wonderful. And we had, I would like to emphasize here the support of the national API authorities. That was the key of what you will hear from Scholar in a couple of minutes. So I will stop here, Reda, and then I will turn myself to invite like it says here, one country that has already begun to harness the potential of the accelerator for its own needs, that is Ghana. Ghana is a country where the scholar group is very strong behind their team leader, Daniela Somani, a coordination team of very dynamic scholar, really leaders, I will call them leaders now, really, they are really ready to move forward with immunization outcome in their country. So I will call the regional director of Ghana, Dr. Alberta Yacon. She's the regional director of the Eastern Half region. She was one of the tremendous support of scholars of the country. She was their motivation. She helped scholars to move forward with their project. She was very supportive. I will stop that and see if I can have Dr. Alberta online. So please, Dr. Alberta, if you hear me, please go ahead and unmute yourself by clicking on the mic. Good afternoon, Doctor.
Hello, can you hear me?
You're loud and clear, Doctor. Please, the floor is yours.
Thank you very much, and a good afternoon to all listeners. It's a joy to be here. As he said already, I am Dr. Alberta Yacon, the Regional Director of Health Services for the Ghana Health Service in charge of Eastern Region with a population of about 3.2 million. Daniel Asumaning, who is the country lead for the WHO scholars in Ghana, is also a member of my staff. And on the 14th of October 2019, he introduced me to the WHO Scholar Program. Indeed, I was very, very fascinated by the whole concept, and he told me that of the 91 scholars that we have in country, 15%, that is 14 of them, were actually in my region. So I wanted to learn more from the other scholars and to support their work so that we could get significant results as a region. I therefore planned a meeting 2 weeks later with them. That's on the 28th of October, 2019. I met all the scholars and I invited all my senior managers, coordinators, heads of departments, and heads of units to the meeting so that they all learn about the WHO Scholar Program. So the objective of that WHO Scholar meeting with the Regional Director of Health Services and her team were to create awareness about the program and also to know where the scholars were in the whole scheme of things. We also wanted to know what their successes or achievements have been, and most importantly, to know their challenges so that we could help them address them at the regional level. After the interaction with them, my observations were as follows. The WHO scholars were very knowledgeable and enthusiastic about their action plans. But I realized that most of the district directors of health services that they worked with were either not involved in the scholar work or were not interested in it. And therefore, the action plans could not actually move forward. But I also realized that the WHO scholars, most of them were treating their plans as personal project plans. So there was no ownership at the district level. Meanwhile, their action plans are supposed to be implemented at the district level. And I also realized that they were having challenges with resources. So the way forward to address it was that I engaged the district directors of health services and importantly stressed the role of the WHO scholars in improving our EPI program. And I charged them to embrace it as a national and regional intervention. The district directors also accepted this, and they went back and also engaged the WHO scholars that they were working with and asked them to share their action plans with them. So together they sat as a team and owned that action plan, so that as the action plan is rolled out with the team leader being the WHO scholar, the whole district benefits and they work with him together or her together. So as of now, most of the districts have had full support of their district health directors and the district health management team, and they are on course. And we have planned that every quarter, we are going to meet the district directors and their WHO scholars to assess where they are in the scheme of things. So by the end of March or the first week of April, we shall have the first meeting to assess progress so far. I must say that as a region, we are very grateful for the impact that we are anticipating the scholars to bring to our region, especially in terms of immunization. Thank you very much.
Thank you very much, Dr. Alberta. That was impressive, and thank you to all the Ghanaian scholars in the room here. I will now turn myself to Reda or to Charlotte for the next step of the program. Thank you.
Thank you, Adam Bless, and thank you, Dr. Alberta Nyarko from Ghana. Ghana is going to be center stage today. However, there are many other countries that are making significant progress along the same lines. We're not going to be able to share everything in today's event. Of course, anyone can put together a few interesting case studies, but remember to really relate what you're going to hear, these presentations of what the change that is being led by the individuals you're going to hear, and that big picture of the system that we have developed together in order to measure, share, and mobilize. Now, Charlotte has been working with the presenters and the speakers for several weeks. So over to you, Charlotte, to start listening to some of the stories that really we hope you will be paying attention to and taking on. Thank you.
Okay, thank you very much, Reda. As you can see, I have shared my screen and I have unmuted. I'm going to just introduce the scholars that are going to present to us this afternoon. And as you I just want to first of all thank the Regional Director for Health from Ghana. I hope you're seeing my screen. All right, so I just want to thank the Regional Director from the Eastern region of Ghana for a wonderful presentation. And I want to call upon Obed Nobe from Ghana, who has been a very active scholar and at companies who decided to translate what he learned from the scholar courses and from the WHO guideline into actionable results on the field. So Obed, you have been unmuted and you have the floor to share your story.
Hello, everyone. I am Obed Nobe from Ghana and work for Ghana Health Service as a Health Information Officer at Swaman District Health Directorate. My work consists of health service data management, including immunization, development of annual program of work and budgeting, trainings, prepare the directorate reports, and also conduct monitoring and supervision to all facilities. On behalf of the District Health Directorate, I'm really excited to share with you outcomes of my involvement in the WHO Scholar courses. I serve as an accompanist during the DIP Level 1 certification course. With respect to the WHO courses that I've taken Level 2 course on reducing inequities and improving coverage, and Level 1 certification course on data improvement planning. The benefits from the WHO Scholar courses are numerous. It has really helped me to sharpen my skills in immunization data analysis, come out with my own project in line with WHO guidelines, launch the project, and also monitor the project and sustain the gains with minimal cost. Also, being a scholar and an accompanist in the WHO Scholar program has exposed me to global immunization systems and aided me with the opportunity to support new scholars. Aside this, certificate from WHO issued to scholars also serve as motivation. During the Level 2 course, I applied the WHO guideline on missed opportunities for vaccination for my project work. I see the Impact Accelerator launch part in July as a trigger and played a significant role in ensuring that aspects of the project I developed could be transformed into action within the 4 weeks period. This is really a new way of learning. Without the Impact Accelerator, the project implementation will have slowed a bit in the district and wouldn't have yielded much results as expected. Before the Level 2 course on reducing inequities and improving coverage, averagely 47 pregnant women were vaccinated monthly with tetanus diphtheria, that's TD2 plus immunization or vaccination against a target of 93, and 51.7% of TD2 plus coverage was achieved in the district in 2018. Meanwhile, antenatal coverage was achieved, or antenatal coverage was 109% in 2018. This led to the development of the project I'm sharing with you today, entitled Action Plan to Ensure Every Pregnant Woman is Vaccinated with 2 or more doses of tetanus diphtheria vaccine in the Swaman district. Together with the team, I plan with them to change the coverage from 51.7% in 2018 to 80% by 31st December 2019. To achieve this, the district carried out a number of activities based on the SWOT analysis in the project. We met and oriented all the midwives and community health nurses on TD vaccination. All pregnant women who missed TD2 plus in the ANC register were listed and monitored monthly for their vaccination status during subsequent antenatal visits. We really went ahead to capture all fully immunized pregnant women at registration as part of monthly report in line with the WHO guideline. We also carried out weekly monitoring and feedback on TD vaccination. On our WhatsApp platform, that's the midwives page, a form was also developed to track ANC attendance and registrants of the TD vaccination status. EPI tally books and vaccine carriers were also distributed to ANC and maternity units in the district to tally the TD vaccination and also document in the ANC register as well, which was not previously done. Supportive supervision was also carried out to assist the staff. Monthly review on TD performance was also done. We procured domestic fridges with support of the MCHIPS and MP's Common Fund to help facilities with cold chain issues to be able to provide daily immunization services, and thus reducing missed opportunities at the facility levels. I worked with my key stakeholders, that's the district health management team, especially the district director, both current and previous director, the medical superintendent, the public health nurse, and the EPI coordinator. In the facilities, all the facility staff were really involved in the vaccination and always in the lookout for defaulting pregnant women. So far, out of 12 health facilities, only 2 do not have domestic refrigerators. We have been able to provide 11 refrigerators to all the facilities. Midwives who were not directly involved in TD vaccination and never vaccinated pregnant women in the district are now vaccinating the pregnant women after the orientation and have continued to date. Documentation of TD has also improved. I'm extremely happy to share with you that by the end of December 2019, TD2 plus coverage stands at 97.5% in the Swaman district. 1,085 pregnant women were vaccinated against the previous year coverage of 51.7%. That's 563. And that made a huge difference as a result of the Scholar project. To conclude, TD2 plus coverage improved in the district just within a year, remarkably because of the WHO courses, which has changed my thinking and the way of thinking of the staff in the district differently, and as such will require the support of all stakeholders and partners of health to help scale up this project in the entire region and country and sustain it with minimal cost to prevent vaccine preventable deaths in the district. To end, I want to also thank the WHO Scholar team for the support provided and encouragement throughout. My gratitude goes to Dr. Alan Bless, my mentor in the Scholar course, and all our stakeholders for the support from national to the facility level. Thank you.
Thank you very much indeed, Obed Nobe, our first presenter. I see a wonderful comments and feedback in the chat. Please share your response to this presentation. And I want to turn to the panel. So several of the members of the International Advisory Board for the Teach to Reach Accelerator, the Impact Accelerator is really built into this Teach to Reach program, are with us. Both immunization and learning scientists are in the room. So I'm going to ask if you'd like to comment and respond, give feedback to Obed. I'm sure he would welcome and appreciate it. If you could raise your hands, otherwise I will make arbitrary decisions about who to receive feedback from. As panelists, I believe you should be able to raise your hand. Maybe you are not. So I'd like to go to Felicity Cutts. Felicity, are you?
Yeah, thanks, Reda. So congratulations, Obed, and thanks to all the speakers so far. This is just so impressive, not least the clarity of the connection. If everyone around the world is hearing as well as I am here in France, then technology is really working well. So that's a really impressive result that we just heard with the TD, and I just wonder, do you have any reflections on how the Scholar and the Impact Accelerator really helped you to do what you did with TD? I mean, why was TD vaccine coverage so low before? And yeah, how did the Impact Accelerator really help you to change that and to motivate everyone to change the way they were working? Thank you.
All right. Okay, that's a great question. Let's go, Obed. Would you like to answer?
Hello, thank you very much for
Yes.
the question. Yes, before the Scholar course, together with the district health management team, the previous director, I briefed him about the project that I'm about undertaking. And in fact, the director actually took the lead. Immediately he heard of the plan project. So quickly, we organized a training, brought all the midwives and community health nurses. And when we brought them, we realized that they were referring these pregnant women to the community health nurses to vaccinate. Meanwhile, they are the people that are seeing the pregnant women directly. So during the Impact Accelerator, when we were given about 4 weeks to implement aspects of the project, quickly, we started listing all those pregnant women who defaulted the TD2+. We went as far back to November and October, looking at those who are still pregnant in July, and we tried to vaccinate all of them. And that actually led to the improvement in the TD2+ coverage at the end of December 2019.
All right, thank you, Obed. I think at least part of Felicity's questions was about if you're able to say exactly how participation in the accelerator or in the courses helped, rather than harping on that. I know that I'd like to ask François Gass if he has any comments to make about this brief presentation. One, we know of many strengths in Ghana that may not be present in other countries. François, do you have?
Yeah. Yes, first, congratulations to Obed for this work. And I think my memory was that in the Eastern region, it's always been considered like a high risk for immunization and for tetanus immunization in the past. And obviously, we have turned around the situation. Now, maybe linked with the question of felicity. My memory, and you have to prove me wrong, that there was a lot of operational issues in the Eastern region, which maybe over the years, there's so many years since I visited Ghana, you have modified. So I'm hearing that your major problem was the missed opportunities, that you were in contact with those ladies, but they were not getting the tetanus dose they needed for some reasons you mentioned. Now, what I am reading is you made it a priority, and you've been focusing on it, and you've been measuring constantly the progress. And the priority came from the EPI manager down to all the nurse or the midwife working on it. I'm sure there's some lessons learned here. And I think the first comment of the program manager, which shows that this was initially working like a pilot project, but not working as a team with the actors of the EPI program in the field, was one of the challenges that you succeeded to overcome. I think there's a lessons learned for whatever priority is taken by the Impact Accelerator to do better in one area, prioritize or not, or several priorities. So I think your experience, I think, is a lesson for all. There's so many elements that you have highlighted that made the difference in the first presentation, and then in your presentation on how in practice you change, you reduce the missed opportunities. So I don't know, if you had to say what were the three critical elements that made it a success, what would be those three critical actions, solutions that you implemented, you executed to make a difference?
All right. That's a fascinating question. Maybe we have many other presenters lined up, and in fact, we thought we wanted to give you an overview of the range of projects and progression in the accelerator. But we have, after this event, you will be receiving a form inviting you to ask to go further and to have a more technical discussion. And we would welcome, of course, the expertise of members of the IAB as well as partners who would like to know more about a specific presenter's work and go further in the discussion. Would that be so? And perhaps the other presenters could keep in mind this this question. We'll now hear, I think we'll go back to Charlotte and hear 3 presentations and then go back to the panel for comments and questions. It's obvious that we are going to go over time. So we did, yes, we initially announced, we weren't sure, yes, we initially announced 60 minutes. I believe with the Scholar team, we've decided to extend by another 30 minutes. So if you need to leave at the top of the hour, that is understandable. But if you're able to stay and you believe this type of discussion is worth it, then please stay on. We'll be going on until 6:30 p.m. Geneva. So that's 42 minutes from now. Back to you, Charlotte.
Okay, thank you very much, Reda, and congratulations to Obed for his presentation. Right now, I'm going to turn to Daniel Asomani, who is actually the country team leader for Ghana, to tell us how they went about setting up a functional country group in Ghana and getting the EPI to recognize them. Daniel, over to you.
Thank you. Good evening. I am Daniel Asomani. I work as a disease control officer in Ghana Health Service, in one of the 33 districts in the Eastern region called Ayinsuano district. I have served as an accompanist in the WHO Scholar Program, and currently I am the country leader for Ghana. I have undertaken GRIPS as one of the courses, then reducing inequities and increasing coverage. Then I have also done the DIP level 1 course. As a country group, we've had a lot of support from involving ourselves with this Impact Accelerator program. And our journey started in July 2019, where we were asked to form. And most importantly, what we started with was to establish a coordination team at the national level who will help, that's myself, the country leader, We also established weekly meetings that we meet every Sunday at 7 o'clock p.m. Ghana time, and that has helped us a lot. The major importance we've had from this Impact Accelerator program is it has helped the 33 scholars in Ghana who subscribed to implement their plans. Out of the 33, 22 of them have now implemented their programs at different levels. And these are very high level innovative programs that is helping to reduce morbidity and mortalities in Ghana. And it has helped us as individuals to make us better persons in our daily endeavors. Yeah, we started this journey by visiting the National EPI Program Manager. That's the immediate past one. Then we solicited for his support. We presented our plans to him. They reviewed and make very substantive recommendations as to how to make the projects better. And they promised us their unfailing support and also urged that we implement it at the district level. Right from there, we engaged our various districts. But however, we realized that it was difficult for us to get projects moving at the pace with which we anticipated. So it meant we need to sit down again, reanalyze the system, and see where we are not getting it right. And what came to mind was the regional directors. The regional systems are the bridge between the national and the districts. So we started with our regional director, who just presented, a very wonderful person, and now an advocate for the scholar program in Ghana. She organized a team quickly, then we discussed issues. Then from there, she tried to integrate the scholar system, that's the projects, into the individual districts, and charge all district directors to ensure that they provide us with the support every scholar needs to make project implementation highly possible. So directors now felt the need to adapt the plans and use it as a district own. Right from there, we realized that the interest of health workers in Ghana, especially in Eastern region, now started increasing, and people started approaching for slots in the future programs. With the future goal, we expect that we extend this approach to the other 15 districts in Ghana, other 15 regions left in Ghana, and we also anticipate that if the country coordinating team, the country leader, the coordinating team could be supported to be able to make ample time and to move around to support scholars in project implementation. It will help a lot. We also wish to help scholars now to raise funds by advocating to our donor partners who have fat budgets but are looking for very innovative programs to work with. We also wish to establish contact with the country offices of WHO, UNICEF, and other major stakeholders in Ghana. We're also advocating that we can have a very big forum where all major stakeholders in health will meet and we will discuss with them our vision and where we expect to take our projects and the scholar community to. We have a very big statement that as Ghana, that guides us in our movement. The statement is, the existence of the WHO scholar community depends on the actions that we take today. And therefore, we urge all of us to contribute our quota to reduce the incidence of vaccine-preventable diseases. We want to appreciate the Geneva Learning Foundation, WHO scholar team, for making it possible to give us this opportunity. A special appreciation goes to Dr. Alan Blessed-Atinku, who has been guiding us and helping us. Then we also want to acknowledge the National EPI Program Manager and his team, the Eastern Regional Director of Health Services, all other scholars in Ghana. Thank you very much.
Thank you very much, Daniel. And as Reda said earlier, we are going to just continue with the next presenter. I would just like to, if you have any questions, you can ask them on the Q&A, or you just know them somewhere, and later on you'll be able to ask or you'll get the answers. So at this moment, I am going to invite Amadou Barry. He's from the Gambia, and he's going to, Amadou Barry. Okay, so Amadou, I see you're already unmuted, so you go ahead and share with us your story on developing an electronic tool that can monitor and track the immunization status of children in the Gambia. Over to you.
Thank you very much, Charlotte. Good evening from the Gambia. My name is Amadou Barry, a public health professional currently working at Actionaid International de Gambia on an electronic immunization registry system developed by SIFO Foundation in Sweden. This electronic immunization registry system project is called My Child Project, Every Child Counts. I became an accompanist after benefiting from the Level 1 World Health Organization's Global Routine Immunization Strategies and Practice Scholar course from March to May 2019. This certification course enhanced my knowledge and skill in routine immunization activity planning. I was also captivated by this academic challenge because it enriched my ability to understand the global routine immunization strategies and practices guideline and applied its concept with limited support to improve immunization outcomes within my district and beyond. The Impact Accelerator was a great tool to ignite scholars such as myself to invest more into our projects. It was a reminder and led me to share my story with you today. I am also honored to participate in my first scholar course on our Impact Accelerator. I invested in a transformative project that can monitor program performance by using innovative tools to identify and track immunization challenges beyond existing monitoring tools. This tool was embedded in an open source software called EpiInfo, developed by the Center for Disease Control to help district immunization officers to identify weaknesses in vaccination timeliness, dose validity, immunization access, and utilization by clinic sites, even by community. District immunization officers can use this tool to develop strategies with limited external support to solve local immunization challenges. I chose this transformative investment from the World Health Organization's Global Routine Immunization Strategies and Practices Guideline to address weaknesses in monitoring routine immunization system components. Because the Gambia, my country, have registered significant gains in improving immunization outcomes, particularly in the prevention and reduction of morbidity and mortality caused by vaccine-preventable diseases. Today, what we need is to identify weaknesses in quality of care to ensure that every child receives his or her vaccine at the prescribed time. After developing this innovative tool, I tested it in my district and the results were intriguing. I realized nearly all the children did not receive their hepatitis B vaccine within 24 hours, and some children by clinic site and even by community are not receiving their penta vaccine series regularly. I could also see which clinic site or community are underutilizing immunization services, that is, communities with high dropouts and lower coverages, particularly among children within the first year of life. These findings initiated some local action, from promoting social and behavior change communication on institutional delivery among pregnant women with the help of the administration of the hepatitis B vaccine to infants born in the health center within 24 hours. This tool was also used to identify communities with high dropout during a one-week campaign to celebrate the Africa Week of Vaccination in 2019 to reach infants, particularly those within the second year of life. During this activity, we vaccinated 151 defaulters, and more than 60% of them were children within the second year of life. Finally, this program offered me the opportunity to work with peers across the globe to exchange ideas, review each other's work, and even collaborate on how to implement similar projects in each other's country. I want to thank the World Health Organization, our supporters, the scholar team, my colleagues across the globe for this great opportunity. I would like to extend my sincere gratitude to Gambia's expanded program on immunization team from the national to the regional and district level, especially my team at Bajakunda in the Wuli East District of Upper River Region. Thank you very much for your kind attention.
Thank you very much, Amadou Barry, for your presentation. Right now, we are going to get on to the third presenter for this session. That is Martha Ndikongwe from Cameroon, the Southwest region of Cameroon, who will be telling how the region developed a common project to address the emergency needs of the children, vaccinated and unvaccinated children in that area, which is undergoing a socio-political crisis. So over to you, Martha.
Thank you for this opportunity given me to share our story on our impact made so far. Hi everyone, I am Martha Ngwe, working for the EPI Regional Technical Group for the Southwest Ministry of Public Health, Cameroon. I serve as an accompanist in the scholar community, a team leader for the Southwest Scholar Alumni, and recently appointed as the country team leader for the Anglophone cohort in Cameroon. I have completed the level 1 courses in global routine immunization strategies and practices, GRIPS, data improvement planning in English, and the Survey Scholar Module A3 course, which deals with the interpretation of vaccination coverage indicators in French. We came together as a team under the banner of the Southwest Scholar Alumni, that's 7 of us, where we use the WHO GRIPS Level 1 guideline to develop a common project. The GRIPS Level 1 course helped us to think out of the box with respect to the ongoing crisis we face in our region. All the scholars involved in the development of our common project had a GRIPS Level 1 course as their first WHO scholar course, and this alone brought us together with some sort of enthusiasm, looking forward to handle the challenge we have on ground. After developing our common project, we all took part in the Impact Accelerator Launchpad in July 2019, where we exchanged ideas with our peers all over the world. This activity was really important as we could have constructive feedback to improve on our strategies from peers with experience to handle similar challenges. This exercise added great value to our project. The Southwest region is a region that is faced with a socio-political crisis for over 3 years now. As a result, we continue to observe a drop in the immunization coverage in the region, with a drop in Penta 3 coverage from 80% in 2016 to 43% in 2019. This drop in coverage is partly because the vaccination team could hardly reach their targets due to the population that is constantly displaced. Also, most of the health facilities in the affected districts have closed down as health workers flee away from these areas due to insecurity. After the GRIPS Level 1 course, we came up with a common project adopted from the guideline, strategies to reach the unvaccinated and undervaccinated children, and to pilot it in 3 health districts which have been heavily hit by the crisis, yet accessible for the immunization activities to be carried out. Hence, the innovative approach with the use of community health workers who are recognized and accepted in their communities was adopted as a strategy for implementation. We work together with the respective district medical officers, the EPI regional coordinator, the regional delegate of public health, and stakeholders such as community opinion leaders, UNICEF, and WHO to have the necessary data, plan with the communities concerned, and also to work on the feasibility for the strategies to use for the project implementation. After the Impact Accelerator, peer review, the project was endorsed by the regional delegate, and thereafter UNICEF became interested in the project. So far, we have been able to come up with a detailed budget proposal, and the regional delegate has decided to partner with the local NGO for the implementation of this project. The proposal has been submitted to UNICEF for funding application. In all, I want to say I'm very grateful to the WHO scholar courses, the scholar team, most especially Dr. Alain Blaise Asinko, who has worked so tirelessly with us, the Impact Accelerator Initiative, all our stakeholders, to our country leaders at the time, the regional delegate and EPI coordinator, and our fellow scholars for their continuous support. That has given us the opportunity to transform guidelines into a project ready to be funded. I'm so much impressed because the project, once funded, will impact the lives of children living in affected areas through vaccination. Thank you for your keen attention.
Thank you very much indeed, Marta and Charlotte. I'd like to go back a little bit to, I'd like to go back to the panel. You heard in the first round of feedback and questions from Professor Felicity Cutts, retired professor at the London School of Tropical Medicine, as well as from Dr. François Gass, popularly known as Dr. Tetanus, because of his involvement and extensive contribution towards the elimination of maternal and neonatal tetanus as senior project officer at UNICEF. I'd like to go now to Alan Brooks, formerly of Gavi, who to ask him a question. If Alan, you'd care to introduce yourself, share your feeling about what you've heard so far, and maybe help us connect the dots. What is the potential, and what is going on from your perspective and with your experience with this Impact Accelerator?
Thanks, Retta, and good afternoon, evening, or morning, depending on where you are, everyone. I'm Alan Brooks. I'm a managing partner with Bridges to Development. And as with many of you on the line, I am also someone that you could say has many bruises and many gray hairs from the challenge of improving immunization and improving primary health care over many, many years in many countries. Because in fact, there have been many things that we've struggled with. And the first piece I want to connect the dots is just congratulations, and to echo the clarity and the strength of the voice about the positivity and the connection and the solutions that individuals are bringing to the table here. So often a discussion is struggles with the challenge to find, so what? So what do you do differently? Okay, and how? How do you do that differently? And in fact, I'm hearing both a change in what and how, in not from Retta, yes from Retta, but especially from those that are participating in the Impact Accelerator and in the wider Scholar program. So that change in what and how gives me great hope and gives me great confidence in the future. The second thing that is so striking is how much this is really happening in every part and every corner of the world. This isn't about just sitting and being in Geneva or in a capital city looking at a situation, but in fact, what I'm hearing are voices from people that are speaking about my community, my district, my sub-district, and how can I make that better? As we know, development is not a process of crossing the goal line. Development is a process of continuous step-by-step improvement. And that's what I've heard on this call, and that's what I've seen in this discussion. And for those reasons, it gives me great hope and a lot of confidence about where to come. So pass it back to you, Retta, but just a couple of reflections trying to connect the dots, as Retta put it, between some of the discussions so far. And the reason I think there's as I said before, I think there's something here. There's really something here, and just congratulations to the team for bringing that forward. Over.
Great, thank you, Alan Brooks. So we heard 3 presentations. Would like to again welcome and encourage members of the International Advisory Board of the Teach to Reach Accelerator program. If you would like to follow up with further comments and questions, and as we have agreed, for those of you who are able to go over time, would welcome a little bit more discussion than we've allowed with so far. We were really concerned that we would be able to fit everything in. So and I want to thank the presenters for the remarkably great job that each person has done. Please simply go ahead and unmute your microphones. In order to comment, ask further questions. Again, on the I think the technical questions will give presenters a good indication of how they're going to be challenged on these results and the progress that's made, and the applicability of that one case to potentially to other contexts and countries. Shall we go to David Kofi, who David, are you there? Are you able to speak to us? Okay, perhaps not. So then let's go to Karen Watkins. Karen, would you be able to?
Yes, good morning and good evening. It's really been fascinating to listen to the.
Whoops. Yes, go ahead, Karen. You were muted
Yes.
again.
Yeah, well, what struck me as really intriguing is how the process, and particularly the peer network, has helped people figure out what is preventing them from reaching full immunization. And I particularly was struck by the story of the case example of the midwives, and feeling that figuring out that the midwives were referring to the doctors was probably something that was there all the time, but somehow in this process it became visible, and they challenged it. So I love that kind of critical thinking that you've been able to accomplish through this process. So it's been, well, of course, I'm always intrigued when we can take learning and turn it into change in a system. And here you're doing it at such a wide scale. Very, very, very inspiring to listen to these examples.
Thank you very much, Karen. Charlotte, would you like to, unless there are additional questions or comments from the panelists, please unmute yourselves. Otherwise, back to you, Charlotte, for the next presenters.
All right, Reda, thank you. We are going to take a next set of 3 presenters. I'd like to invite Aniket Rana from India. He's going to talk about reaching children in high-risk areas with special immunization strategies. So Aniket, if you are well set, you can share your story with us.
Can you hear me?
Yes, we can get you.
Thank you. My name is Dr. Aniket Rana. I am working with WHO Gujarat, India. I work as an accompanist in one of the scholar courses and completed 4 courses till date: Data Improvement Plan Level 1, WHO GRISP Level 1, GRISP Level 2 in reducing inequities and improving coverage, and last Impact Accelerator. Which guideline I use in my project? I use Urban Immunization Toolkit, September 2018. Now, how Impact Accelerator affected or provided opportunity to me is provided excellent opportunity from creating a project in Creator to actually implement at local level in my setting. And there are many learning opportunities to learn from peers, to learn from other country scholars. So it's a huge impact and changed my view on immunization. So my story started, my project started in urban setting. So what we found here is that 40 to 50% population are living in urban area and they are at a disadvantage. So reaching those unreached population of urban migrant is my target in Gujarat, Ahmedabad Corporation area. What I have done is we have identified and validated migratory high-risk area like industrial migrant slums, construction sites, nomads, and homeless night shelters. So those are most disadvantaged children, and even in our recent country comprehensive multi-year plan, Government of India has emphasized on identifying and vaccinating these children. So in that we have, I work with Ministry of Health, local medical officer, ANMs, community health workers, urban development bodies. They are providing us a map, a ward-wise map of urban area. Malaria frontline workers providing us the list of various construction sites they are visiting for malaria control activities, and the local councillors. We have also used a platform like Corporation Task Force in raising issues and try get support from other department like Angawadi workers, like welfare department. We train medical officer and they in turn train health worker in identifying high-risk areas. We also rope in the external monitors who have validated those areas, identify health workers. So by all these activities, which we have started in July 2019 and completed just before December 2019, we have identified around 1,200 sites, or validated sites. Out of that, 176 are new sites, which surprised both me as well as immunization manager. And they are not a part of microplan, routine microplan. Most of them are construction sites and nomads. Few sites are in between borders of urban health centers, catchment areas, or corporation area and districts. So those sites are identified and incorporated. We also enlisted the list of children which have not received vaccine as per age in those sites. And there is one great opportunity which is lying there in December 2019, Mission Indradhanush Catch-up campaign organized by Government of India. So along with this 176 sites, we have also identified other poor performing areas of corporation. So what I have mentioned, out of 500 high risk area, we are able to vaccinate 2,500 children in those areas. Almost 30 to 40% of children are first time vaccinated in this round. So that's a great achievement. And again, in second catch-up round, we able to vaccinate 1,995 children. So thanks to the scholar courses, I have learned very detailed in immunization. So I am now becomes more effective as well as efficient in delivering my services to the community. Thanks, Scholar team. Thank you very much.
Thank you very much, Aniket. Yes, Reda? All right, so thank you very much.
I see a comment from a Professor Felicity Cutts, who has to leave, but who congratulates the scholars for all their great work so far and the obvious dedication and enthusiasm shows today. It will be helpful, she writes, to hear more about how scholars manage to reach out to government officials, such as the regional directors and EPI managers, in settings where the latter has not yet participated in scholar programs. These connections seem vital. For countries that have not presented today, I'm sure you have lots of good experience to share next time. We'll look out for you. And indeed, I've spotted a number of messages from people who are wondering if their country is going to be represented today. This is the very first time. This is the very first global event. It feels like it is not going to be the last. So rest assured that every country in which scholars are making progress, every scholar that has successes, but also challenges and barriers to report and share with back with a global community. That is at the core of what we're trying to do, is to, in productive ways that can help lead to change and help those leading change. So Charlotte, would you like to go to our next presenter, or we have, keeping in mind the constraint of time, I know we have, my suggestion is to go to Dr. Franck-Hilaire-Bété and Dr. Hassan Ben Bashir, respectively National Managers for the Expanded Program of Immunization in Benin and Cameroon. We have heard presentations, but it would be great to get the perspective of these country leaders for immunization.
Okay, well, thank you.
I suggest we start with Dr. Bashir Ben Hassan. Welcome, and thank you for joining. Are you able to speak to us? And if so, would you like to respond to and comment on the presentations you've made so far? What is your feedback to scholars? And can you tell us how in Cameroon EPI has been harnessing the program to serve its own needs and the country's objectives?
I'm sorry. Okay, yeah, he's there. He's unmuted.
All right. Okay. All right. It looks like as a connection issue, let's go to Franck-Hilaire-Bété. And all right. Otherwise, we'll proceed with the presentations and give our panelists a little bit more time to a little bit of time to figure out if there's a way to get their connections working. But of course, we very much wanted to hear from you and hope that we will be able to do so. All right, Charlotte, back to you and to our next presenter, I believe.
Okay, so right now we are going to listen to Clement Avoka from Ghana, who'll be talking about how he used the WHO guidelines to develop a composite plan to improve immunization coverage, data quality, and utilization in his health district. So Clement, if you're getting me, you're unmuted, you have the floor.
Thank you very much, Charlotte, and good evening, everybody. Yes, my name is Clement Avoka, a senior technical officer in disease control and work with the Ghana Health Service at the Achimansa District Health Directorate. I am responsible for planning and implementing programs in surveillance and the immunization program in the district. I have so far undertaken and completed 3 WHO scholar programs, including the DEEP 1, GRIPS Level 1, and the Level 2 Reducing Inequities program. I served as an accompanist immediately after my first course and have since supported quite a number of scholars who started successfully and completed the scholar program. In fact, my 3 programs, I tried to put all the action plans I developed into a composite action plan and share them with the partners who matters. That is the Regional Director of Health Services and the District Health Management Team. The scholar program, in fact, has been a lot of help to me and my district team as far as immunization is concerned. Before I joined the scholar program in 2018, my district immunization coverages has started declining since 2012. But I realized that when I joined the scholar program, my capacity in planning and implementing effective programs to improve coverage was improved. And also building capacity to effectively analyze the immunization data for action has also been improved. In fact, enhancing networking, that is learning from other peers across the globe, and even my colleagues in Ghana, has also improved. The coffee meeting we have with scholars from other countries has been so helpful. I have some of them who are still contacting me today and we share ideas. And learning together, what I mean is that what Obed presented, because he does the presentation on our Ghana weekly meetings, I try to adapt his strategy, and TD2 plus coverage in my district has also improved tremendously. Yes, the benefits of the Impact Accelerator. In fact, the Impact Accelerator had been something like a catalyst that helped us to translate the knowledge we acquired through the scholar program into action. I was able to take my composite action plans and implement almost all aspects of it. It's left with only one aspect that is still outstanding because of lack of funding, and that is quite technical. The Impact Accelerator, in fact, helped me to mobilize resources. When I started the course, I was confused as to where and how I was going to get resources to implement the plan. But in the Accelerator program itself, has the component that will actually help you as a scholar to mobilize the resources that you need. And also has enhanced teamwork, because you need to engage a lot of stakeholders who will help in the plan implementation. In my district, the key stakeholder has to be with the Ghana Education Service, where we collaborated with them and have trained all teachers that are teaching children in the preschool level, because children that are 1 year and above have started school, and their parents no longer bring them for the immunization services in the district. So we try to engage these teachers who are helping the nurses to now conduct the immunization services every month in all those schools. And I think the WHO scholar team also demanding for weekly progress report was also a main motivation that pushed me to always work further and then make sure that my plan is on course. The opportunity to meet high level ranking personalities like the Regional Director of Health Services in the Eastern region, and then the National Director for EPI was also a motivating factor. And I think without the Impact Accelerator, I might not have gotten the opportunity to meet these people. I really wanted to change or to improve immunization data quality, availability, and utilization with my Deep 1 plan, and also to improve immunization coverage with my GRIPS plan, and then also increase vaccine uptake, especially during the second year of life with my Reducing Inequities plan. Activities that are being carried out so far include, but not limited to, like I said earlier, sensitization of my colleagues at the district level and sensitization of all health workers who are into immunization services, and also teachers. Over 100 teachers were trained on immunization to support nurses to conduct school vaccination services. The DHMT, like my district director, has been of immense support after she received a direction from the regional director of health services to adapt the scholar plan and make it a district plan. We have since been working on it as a team, and any funding we have that is into EPI, we always will channel it into implementing portions of this plan. Dr. Alan Blaze has been of so immense support to us, the Ghana Scholars team. He joined with us on our weekly meetings to discuss with us our plan, how to modify the implementation plan, and this has been so helpful to all of us. Bringing me this far, I can say that the results is that there has been data quality. Data quality has improved tremendously in my district. Now, when we receive data quality feedback from the regional level, my district is always either first, second, or third. And I think it is because of the impact acceleration that we are able to implement the action plans that were developed during the course. Now we are able to do data validation every month at the district level, and then have trained the sub-district teams. They are also able to enter their own data and do some kind of data validation. This has led to the data quality being improved in the district. I am hopeful. I will not be able to attribute any success now to the other plans because we've just started the implementation, for instance, the school vaccination in November. And so I'm hopeful that by the end of 2020, I will have positive results to share as far as increasing immunization coverage in the district is concerned, and then also increasing TG2+ coverage is concerned. Thank you very much for your audience this evening.
Great.
Okay, thank you.
Thank you,
Yes,
Clemente and Charlotte. Yes, so we are technically 4 minutes away from but we hear you. And again, this is only the first global event. So I don't want to stir the pot by saying that we have saved the best for last, but I want to say to Nigerian colleagues who have been leaving comments, and there is certainly strength in numbers. Well, actually, this was one of the most compelling stories I heard as that personal experience, that personal engagement in and for public health. So I'm actually really happy that Ogechukwu Chigbo is our final presenter for the day. We have other presenters. It feels like you're going to give us feedback on this event. If the feedback is good, we will organize another one and continue the discussion and have more time for discussion and perhaps more technical dialogue. So Ogechukwu, you are our last presenter, and I thank you for that and look forward to listening to your story.
Hello?
Yes, please go ahead. And you'll have to speak really loud and really close to your microphone.
Yeah. Can you hear me?
Loud and clear.
All right. My name is Ogechukwu Chigbo, and my Impact Accelerator reports is working to reach underserved children, border and security compromised localities in Kogi and Benue State. By way of introduction, my name is Ogechukwu Chigbo. I'm a cluster coordinator in WHO Benue State, Nigeria. I am an accompanist of Impact Accelerator course. I have participated and received certificates for 3 WHO Scholar courses, Module A3 WHO Coverage Survey Managers course, Immunization Inequities and Improving Coverage, GRIPS, Level 1 Certificate and Impact Accelerator courses. Benefits of WHO Scholar courses includes WHO Scholar course have impacted positively in me by helping me to apply the knowledge gathered in the course to my work. As an immunization program officer, the course made me to understand it is my duty to ensure the last child is reached and immunized. Until date, it has sinked into me because during our scholar courses, the assignments, you don't get it from the materials. You really need to think and think deeply. And for sure, once you think deeply, the intuitions will come and you'll be able to cover your area of studies. In my projects, I use GRIPS guideline by investing on strategies that identifies underserved and unvaccinated persons and regularly provide them with the vaccines they need. I was sent to Kogi State as one of the management support team by WHO in response to the most recent case of circulating vaccine-derived polio type 2 reported in October in one of the LGAs in Kogi State, Olama Borough. On arrival on the 5th December, I was deployed to that same LGA, which shares border with Benue State, where I work, and Enugu State. During the LGA training, I laid emphasis due to the knowledge I have gathered from WHO Scholar course to ask questions about people at the border, IDP camps, and then to support synchronization meetings to ensure that all the children within the border and IDP camps or the underserved populations are immunized. As others, we are mentioning the names of the settlements at the border. The world focal person, one of them from KJ4, confessed they have been concealing vaccine hesitancy occurring at the border between Benue and Kogi. I became interested and quickly developed plans to visit the border settlement and investigate the reasons for rejection and find solutions to immunize our children. These are the activities I implemented. On the 9th of December 2019, I, the EPI team and representatives of CDC Affinet visited the settlement after sending a message to inform the traditional leader that we are coming. To our surprise, instead of meeting the traditional leader, use and half of the members of the community leader assembled to meet us. They were ready to fight us, just at the mention of anybody from Kogi. They did not allow us to see the traditional leader. They said, we are here to take over their land and kill them. At this point, I realized that people from Kogi cannot solve this problem, and I took over and informed them that we are from Benue State, and we are here to find reasons for vaccine hesitancy within the border. We are made to understand that Kogi has refused to leave their land, and they have seen teams that have come in the name of immunization team and immunized their children, and some of them died. And again, the Kogi team have been encroaching in their lands and refused to leave them alone. Because of the enmity existing between them, they have refused to have anything to do with Kogi team. This deliberation lasted for more than 3 hours without achieving anything, and we were asked to come back the next 2 days. On our appointed day, they still refuse we should see the traditional leader and insist we must abide by the conditions they have given to us. At that time, I sent information across, but at that time, they had already sent information across the community that some people are coming with poison vaccines to give to their children. They now said we must have to test the vaccines on the day, give to the youth leader to take before we can immunize their children. And we must not mark the houses or record any child immunized in that settlement, because we have the intention of giving the houses to Kogi, and also the number of their population to Kogi. Meanwhile, I've made arrangements with Benue from Omadibo local government, which is the nearest local government bordering the LGA. At last, on the D-Day, we went to the settlement, and as I agreed, They allowed us to immunize the children because I went there with 400 doses of OPV vaccines from Kogi. And I arranged with the community leader to provide us with the people who will be trained by us to immunize the children. This was done, and on that fateful day, we were able to immunize 123 children, starting with the youth leader. After we must have tested the vaccine, we spent 3 hours in the community, visiting households, churches, playgrounds, water points to immunize the children. This brought peace, joy, happiness, and harmony between the two communities. And as at the moment, both Kogi team and Benue team can move around within the settlements and immunize the children without hedges. And they have been accepting our vaccines. They are now happy, and there is peace and harmony. I had some challenges because when I informed my supervisor that I want to go there, because of how violent the community is and the information that have been gathered before now, what has been existing between Kogi and Benue State at the border, he did not allow me to go due to security reasons, but I insisted, knowing too well that Kogi team may not continue with the case if I have to leave them. But to God be the glory that we were able to achieve huge success. Until date, there is peace, and vaccination teams can move in and immunize our children. Thank you very much for the opportunity.
Great. We are going to have to stop here. Thank you so much. I'm glad that the story was the last one. This story, in many ways, is not specific to any one country because vaccine hesitancy is a challenge, one of the challenges that we are facing. I would like now to bring this first global Impact Accelerator event to a close for the Anglophones. And I really want to thank, I want to add my gratitude to Alain Blaise Tatsinku for the exceptional leadership and inspiration that he's provided to so many scholars. I want to thank Charlotte and Boo for putting so much diligence and intelligence into preparing this event, working with, and of course, I want to thank the scholars, the rest of the scholar team. In order to close, though, I want to, first of all, for those of you who are new to the Scholar Program, to encourage you, if you'd like to be a part of this, to join Teach to Reach, which you can see here. I'm just typing in the link into the chat. And you need to apply, but if you put together a good application, there's a fairly good chance that you will be accepted. And to close, I'd like to ask Dr. Carolina Da Navarro from the World Health Organization, but who may be speaking with her heart and in a personal capacity. She'll be the one to tell you. But she has been along with us in the journey of many scholars. She used Scholar for her own needs for the new survey recommendations, but I think her involvement has extended far beyond that. And that's why I'm really pleased. I asked her if she'd be willing to close this first Global Impact Accelerator event with her thoughts and reflections on what she's heard today. Carolina?
Thank you, and I'm really humbled by all your presentations. I think that when you're in Geneva, sometimes we get so detached from realities and the human aspect of how you need people like you with that passion, with that willingness to do better, to learn, to implement, to think, to be creative, and ultimately to be ready to do better and vaccinate people where they need it. And somebody said it, we are together in this, and I'm really glad to close here this session, because I really think we need to keep sharing the experiences and telling people. I also come from a developing country, I come from Latin America, that we can do it, that we can do it in our own countries, that we can help fix our own problems and vaccinate our children. So thank you so much, and humbled to be here listening and learning from you. Thank you.
Thank you, Carolina. And if this is the first event, you'll be asked for feedback right after it. So take a time, there's 5 yes, no questions. And then if you'd like to share your thoughts or what you got from this event, that really helps us to improve and will help us decide if we should pursue this and hold a second event. So do take that time. Thank you to the members of the International Advisory Board. I'm sorry, I apologize to the members, Dr. Hassan and Dr. Bete, who were not able to speak due to technical issues, but that's part of this new medium and one of its current limitations. Look forward to the next steps. Everyone will be receiving the recording and the slides from these presentations. And of course, there's much more coming with Teach to Reach. You have until Sunday to apply. Thank you once again. Take care. Wishing you well. And we are indeed together in this struggle to ensure that every child who needs to be protected from vaccine preventable diseases actually is. Take care and goodbye.